Hello friends, I am Dr. Sriharsha, consultant nephrologist and renal transplant physician here at Sparsh Hospital, Yelahanka. The topic I would like to discuss with you today is urinary tract infections. It has become a very common problem where pandemic of diabetes, we are seeing a lot of patients who are having urinary tract infections. We see that a lot in elderly females, also the males, people who are obese or who are on the higher side of BMI, people who are immobile and have had any stroke or bedbound. So these being the risk factors for urinary tract infections. The most common culprit among all this is uncontrolled diabetes. Anyone whose sugars are not controlled and the diabetes has been there for more than 5 to 10 years are at risk of developing urinary tract infections, especially if their work involves a very sedentary lifestyle. The studies have shown that treatment of urinary tract infections early in the phase of the disease prevents occurrence of chronic kidney disease, because repeated episodes of urinary tract infections can also lead to changes in the kidneys and can cause direct damage to the kidney. Hence, the first and the most important thing is to control the sugars, and second important thing would be to know that you have urinary tract infections. How do you know that? You have to follow just 2 or 3 simple steps. Is there is any burning sensation of urine, if you have any fever, if you have chills, or if you have any rigors, or patients who are unable to take anything orally. If you have any one of the symptoms or all of the symptoms and you are a diabetic, you need to screen yourself for a urinary tract infection. Contrary to the belief that antibiotics cause a lot of damage, it has been proved beyond doubt that early treatment with antibiotics, especially in a case of urinary tract infection, prevents further spread of the infection to the kidneys and is protective against the kidney. However, please make sure you are seeing a qualified physician or a nephrologist or a urologist for your treatment of the kidneys. Diabetics and hypertensives should monitor their urine every 6 months or a year to rule out any kind of urinary tract infections. We at Sparsh Hospital Yelahanka are giving state-of-the-art services for a treatment of simple as well as complicated UTI. Anyone who requires any surgery for a complicated UTI, having prostate or any kind of urological abnormality, or cases like post-transplant UTI, all these cases are very complicated and we have all the facilities here to deal with that. So friends, anyone in your family suffering from this kind of repeated episodes of urinary tract infections or having kidney or a urological problem, you can always avail our services through website or our social media handles. Thank you.